Hi guys, it's Nurse Jello, and for today's topic, I will be talking about how the Jamaican hospitals are preparing for Hurricane Melissa. And this is a very important topic, especially as it's starting to rain a little here in Montego Bay. I spoke with some of my family members in St. Elizabeth, and they said the storm is there, the hurricane is there. And my family in Westmoreland, they said the hurricane is also there. It's raining, it's windy. We're expected to get Hurricane Melissa by 8 p.m. According to the notification from our hotel, Monday night until 8 p.m. Tuesday night. So I just wanted to talk about the health aspect of and how the hospitals are preparing for Hurricane Melissa, or have prepared for Hurricane Melissa. And the sources that I'm using today are from the Ministry of Health and Wellness Jamaica, or you'll hear me use MOHW, also from the Jamaica Observer, RJR News, and the Office of the Prime Minister of Jamaica. The Ministry of Health and Wellness Jamaica has issued a health advisory for inclement weather or tropical storm preparation. And it includes that all the public hospitals in Jamaica have entered emergency mode. And some of the key measures that were announced are suspension of all outpatient services and elective surgeries. So if you had a hip surgery, knee surgeries, all of that schedule, those of course are all canceled so that the hospital can focus on emergencies. Of course, clinics should have already been closed or closing early, and the hospitals are limiting non-critical visits. The MOHW's Emergency Operations Centers has been activated, and they're focusing on priority facilities. So there are 25 hospital and over 91 health centers that they have identified as command centers. Emergency staffing and systems are in place. They also have, for 75% of those facilities, they have backup generators that are expected to last for about 72 hours. Also, there are medical gas supplies, strategic stockpiles of medication, consumable, verified to last for at least 72 hours. And the communication systems, of course, which is super important, the communication systems and the transportation fleets for emergency response are functional in most priority facilities. And the government is also advising the public, which has been on the news, so the public is already aware of this, that you should already have a kit, a 72-hour kit with food, water, medication, flashlight, battery powered flashlight, and radio, battery powered radio, especially for people with chronic diseases. And why is this important? It's important because when Melissa comes, when it hits, it's expected to bring heavy rain, winds, as you can probably hear in my background, the winds going, possibly flooding, landslides. And the health sector is bracing, not just for direct injuries such as wind damage, trees falling, debris, but also secondary consequences such as disruption of the supply chains. That's like your medication, your power, being prepared for those waterborne and vector-borne diseases from flooding and stagnant water, and a higher risk for the vulnerable population, such as people with chronic illnesses, the elderlies, disabled, and pregnant women. So if that's your family, guys, that falls especially into that category, call them, check on them, see how they're doing. You can't be there physically, but you can show up for your family emotionally, reminding them, hey, remember to take your medication, because the hurricane can be stressful. Remember to take your medication so that when the storm's over, their illness does not get worse. As a resident, what should you know, or people here in Jamaica currently? The hospitals will remain open, but anything that's non-urgent is temporarily suspended. Like I said, outpatient, elective stuff, all of that suspended. But the hospital remains open for urgent situation. So if somebody's going to the hospital and it's considered non-critical, they might ask you to get your family to pick you up because those beds are just available for emergencies. And for those, again, with critical illnesses, please make sure you have your medications at hand. Make sure you understand how to take those medications. And if you have your doctor's number while you're still able to get the doctor, if you still have signal, you want to reach out and say, how do I take this? Is this twice a day again? Is this once a day? Make sure you are getting that correct information so you can stay healthy while you're being barricaded in your home. And please remember, when you're getting your sources, make sure it's official government sources. Not all these social media sources are up to date. A lot of them are unverified. So you want to make sure you're getting it from the ODPEM, for example, the Office of Disaster Preparedness and Emergencies. You want to make sure you're getting those information from official government sources. And just a reminder, we are equipped in Jamaica. The hospital is equipped for about 75% of the facilities. So 25% of the facilities might not have these resources, and so the hospital has become more vulnerable. So that's just something to keep in mind. And just a reminder, the supply chain, the food, of course, can be affected, but also the medication is getting delivered to the hospital, because the fuels can also be affected, because a lot of these gas stations will be closed. And just the anticipation of the roads being flooded and landslides, that's going to make it even harder for the emergency team to get to where they need to be. So just keep that in mind as well. Guys, the 72-hour preparedness is good, but the system lasts longer if there are extended events and if there is a longer period of recovery. So just keep that in mind. Residents, this is for you, should not assume that all services are fully normal, even in hospital emergency mode, because a lot of these resources have to be relocated to help with reducing non-critical services. Thank you guys for tuning in with Nurse Jello. I just want to give you guys some education, get you guys to think about, the patients that are sick and at home and at barricaded, and the hospital resources. And just remember that the hospital is still open for emergency. But if it's not an emergency, you wanna stay home, stay safe, out of the storm. And all the best to you guys. I am praying for you. Like I said, I checked in with some of my family in different parishes, and praying for them and praying for the whole country, and praying that our casualties will not be critical, and that we can make it through Melissa even stronger than before. Thank you guys for tuning in with Nurse Jello. Thank you to all the healthcare workers that are showing up and going to the hospital during this hurricane. Know that your services are respected. Your services are appreciated. Have a wonderful day, guys.